So again, today we're encouraging anyone who has any symptoms of COVID-19, no matter how mild they are, to come forward and get tested straight away and don't delay in doing so. Even though they might be the most mildest symptoms, please don't dismiss them and don't put it off even 1 hour, 2 hours, or certainly not 1 or 2 days. We want everyone who's got any symptoms to come forward and get tested straight away. There's also plenty of access to vaccination appointments, right, in terms of for the GV Health Hub at the Macintosh Centre, but in general practice and community pharmacies now there's plenty of access to vaccines. So if you haven't already had or made an appointment to be vaccinated, please do that straight away. In regards to the number of active cases in Shepparton at the moment, there's 24 in total. In the last 24 hours, there's been 12 new cases. They're spread across, in total, all of those cases spread across 11 households, and only 2 of those households are linked. So there's a number of different methods of transmission that are occurring at the moment across the community. And of course, that again relies on all of us doing those little things to make sure we keep our distance, wear masks, sanitise, certainly check in to any of the venues or locations that you're going around town and about your normal business, because that gives our contact tracing team the best chance of getting on top of things as quickly as possible. So just in relation to contact tracing team and supporting the efforts of those people right across the state, not only at GV Health but right across the state, that are working really hard. If the contact tracing team call you, they're calling for a reason. Please don't make their jobs any more difficult than they need to be. They're here to help not only you and your loved ones, they're here to help the community more broadly as well. So please make sure you provide full and detailed information to the contact tracing teams, because it's only going to help them do their job more effectively and more quickly, and get on top of the outbreaks that are occurring and the new cases as and when they occur. In regards to testing, there's really good access to testing in Shepparton at the moment. Yesterday, across the 2 sites that GV Health is operating, there was 760 tests performed. Over the coming weekend, we will have the acute respiratory clinic in Graham Street, Shepparton, open, as well as the Shepparton Showgrounds site open, and we'll put the exact opening hours of those 2 sites on our Facebook pages later today. And happy to take any questions from here.
Where's most of the transmission happening?
Mostly, so again, there's, at the minute, I think it's community based in terms of people picking it up in terms of the initial acquisition, but that's one part of it. But the big part is certainly household transmission. So again, we have across those 11 households, there's a few people that are testing positive within the one household. But of course, what we've seen in recent times in Shepparton and more broadly with Delta is that it spreads very quickly amongst households as well. So household or people moving between households is really a big risk factor at the minute. So those directions about everybody not going to each other's house are really important for that very reason, because it stops the transmission, and we've seen evidence of that in other parts of Victoria in recent days as well.
What do you say?
Do you think we're edging onto another lockdown, Matt, in Greater Shepparton?
That's really the decision. The decision making for lockdowns are purely a matter for the public health unit and teams in the Department of Health centrally in Melbourne. But it is a bit of a concern to me, at least, that we've had certainly 12 cases in the last 24 hours come through in that reporting period. And already we're starting to see a small number during the course of today as well, which is a normal pattern, of course, as the test results come in. And as I said before, it was a larger testing day. 760 tests yesterday is a bigger day than what we've done in the last week or two. So again, I think the best way to avoid a lockdown is for everyone in the community to do the right thing and follow the directions and those good hygiene practices.
So when you say community transmission, do you mean more house to house, or people in the same venues like a coffee shop or at a pub, or is it?
I think it's a mix. Yeah, mixed. Primarily, it's the household movement, but again, we know that's a big means of it, but the community transmission around venues is still a big risk for everybody, and we're seeing both.
Yeah, and in terms of contact tracing, are people actively trying to counter contact tracing efforts, or they're not being helpful, or it sounds like people aren't trying to help out?
So I'm happy to clarify the sort of comments I made a few minutes ago. The majority of people are doing the right thing, and I think it's important to recognise that, both not only in relation to their cooperation with the contact tracing team, but in general, more broadly with vaccination and getting tested. But what we are seeing, which I guess is the disappointing element, is that where there is transmission, there are times where people aren't doing the right thing in terms of their movements and the like, but also some of those people, a small number of people, are those that aren't being totally forthcoming, unfortunately, with the contact tracing team. And as I said, that makes their roles, the contact tracers' roles, even more difficult than it already is.
How many people are currently in isolation?
I don't have that number offhand, but we're happy to provide that later on. We can clarify that for sure.
You mentioned the other day that this outbreak feels a bit more controlled, I guess, than the previous outbreak. Are you still feeling that way?
I think that the main difference with this outbreak is that we haven't had a large number of people test positive quickly up until the 12 in the last 24 hours, of course. But I think the other part that why it feels a bit more controlled is we haven't had the large volume of people in relation to the exposure sites being primary close contacts and secondary close contacts, and of course that's really driven by, thankfully, we haven't had the school exposure sites to contend with in the last few days, whereas in August and September that was a big factor.
Are there any mystery cases?
Any of the cases where we're unable to determine the acquisition link would be considered a mystery case, and that's really the important part for the contact tracing team, to be able to determine how the acquisition or transmission occurred. So yeah, the majority of them are not linked, and that's the work of the contact tracing team, and they're going as hard and as quickly as they can to get to the bottom of that.
By the majority, can you give me a number?
So it's, as I said before, we're across 11 households, and 2 of those households have got linked transmission between people in those 2 households, but there's 9 households where the link or the acquisition for the first person that tested positive in that household hasn't been determined.
How concerned does that make you?
I guess it is a concern, as I said before, while there's unknown transmission in the community, it is a concern, because how much broadly or widely is that transmission that we don't know about, in terms of people that could be positive, that may not necessarily know that yet, or know that they've been exposed. And as I said before, I just can't emphasise enough that if anyone has even the most mildest symptoms, as soon as those symptoms start, get tested straight away. There's really good access to testing. That's not an excuse in terms of testing not being available. There's plenty of access at our sites and other community sites around Shepparton and indeed the state as well. So that's another thing that people can do, is get tested straight away.
And I see the Nido Early Learning Centre as an exposure site. Is that of concern with families involved?
It is. I mean, any of the exposure sites where you have numbers of people that are in close proximity, like a childcare centre, is of concern. And also, we know with the Delta variant, it's a lot more transmissible to children and young people, both preschool age and other school age children. So that's certainly a concern. But I understand the people from that childcare centre have done the right thing. They've come forward for testing and they're isolating, and the results of those tests should be known in the next 24 to 48 hours.
Do we know if it was a child at the centre, or a teacher, or a parent, or...?
I'm not actually aware. I think it was one of the attendees in terms of the children, but I'm not 100% sure on that.
And do you know how many people are in isolation? Oh no, I was going to say in that cluster, but could get that later, that'd be great.
Yeah.
Thank you.
Yeah.
I'm all done.
And then just the other thing would be in terms of vaccination. There's been another push with mandates today. In terms of GV health, are you expecting any workers not to meet the mandate by October 15 of all healthcare workers to have at least one dose?
So at the moment, we know from a GV health point of view, 86% of our staff have had a double dose vaccination. A further 10% have had a single dose vaccination. So looking at that in terms of the mandate by the 15th of October, we're at 96%, which I think for the first dose that is, which I think is a really good effort, and we've been working hard to get all of our staff vaccinated as quickly as possible. So we're at the tail end of that now. I think based on what we've seen in relation to aged care, because aged care was the first parts of the broader health and wellbeing and aged care system, of course, to have the mandated vaccination. We've only ended up with a very small number of staff who have chosen not to be vaccinated, and we're just working through that with those people at the moment. But generally, I think where we're headed at this stage, being 2 weeks or so before the 15th of October, to have 96% of staff having a single vaccination, I think is a really good outcome, and we'll work hard to close that out in the coming couple of weeks.
So you don't anticipate any staffing shortages or anything?
No, I don't anticipate. No, don't expect that'll have a significant impact at all on services, absolutely, but we'll be able to cover any of those shortfalls that might arise.
Yeah, and in terms of the announcement by the Victorian government that a whole massive host of industries and workers need to be vaccinated, is there any concern about being able to meet a surge in demand of people now coming forward to get vaccinated? No,
there's plenty of access. There's appointments right across the state-based systems that the Victorian government's operating through the Department of Health. There's plenty of access to appointments, but there's also, as I said before, good access in GP clinics and community pharmacy. So I think there'll be plenty of opportunities for people to be vaccinated.